Okay, now that you've thought about your boundaries as a caregiver and some of those items of strengthening your caregiver health, it's time to think about that second bullet, the financial issues surrounding the actual caregiving situation. We've listed here 4 items to consider. This happens to be the topic of an entire course that we teach around the financial situations connected to caregiving. But in just a couple minutes here, let me explain those 4 areas. We've got another page in your workbook set aside for you to make notes and capture ideas that you might want to pursue further in each of these areas. First, the costs of care. This is a monster moving target. You can never nail it down. You can never get precise with what care is going to cost. When you search online for the cost of care for seniors or cost of care for caregiving, you get a barrage of ads, mostly selling senior housing and home care services. And occasionally you'll find a good calculator out there that might give a sense for how much a particular service will be, but it's just one piece of many. The big mystery is what will change in the condition of care. You might be able to know today, but how much additional care will be needed and when? What will be the medical bills and prescription costs, and how will all those affect the cost of everyday living, like food, clothing, utilities, not to mention travel or hobbies and end-of-life care? And how long will life last? Like I said, this is a monster moving target, but it can be a productive exercise to figure out what the current care condition costs on a weekly, monthly, and annual basis. And then scenarios can be run for if the costs stay the same or increase at different levels and impact, how long those scenarios will last. I've met more than one caregiver who's benefited by being able to see what costs are today and maybe tomorrow, simply as a directional help to know where there might be gaps and what to do to fill those gaps. That second item there, the care recipient's resources, the list of your loved ones or recipient of care's resources it may be best created using that same outline of categories as when we looked at the caregiver's financial resources, assets, liabilities, equity, credit, insurance. Here, however, you're looking at it with a different lens because your loved one's resources are primary in the caregiving situation, meaning they should be tapped first. So the caregiver's assets, debts, and equity give a sense of how much net worth is available to assist with caregiving. Do they own or rent their home? Is there equity in a home that might be accessed through a home equity loan or a reverse mortgage? Now, a reminder, none of what we're talking about here can be or should be construed as advice. We just help make observations and call out facts that might be considered. All caregiving should be done with help from wise and trusted professionals. Of particular interest here is the recipient of care's insurance. Do they have health insurance? Does Medicare or Medicaid play a role? Do they have a long-term care insurance policy? How does it operate? Does it have limits? What about life insurance? It's often very valuable to examine trusts, wills, and other documents that might give guidance about the wishes of your loved one. An elder law attorney can be a very worthwhile investment, especially if there are considerations to make about how an individual or family qualifies for or accesses public and government assistance, which we'll cover in a moment. Third are family resources. And when we say family, we mean spouses, parents, children, siblings, but also extended family as well. And if there are neighbors, friends, or others who want or should be consulted about providing financial support and assistance, this is the category that considers all of those together. When I talk with caregivers, especially those with whom I enjoy a close relationship and I hear their candid story, when we talk about how care is being paid for, I am so surprised at how seldom they and their families have had a deliberate, forward-looking, open-minded, transparent conversation about this. I've known of caregiving children who've said to their siblings, I don't want to know the finances. I don't want to know how bad it's going to get or how good it is. I just don't want that part of my parents' lives exposed to me. And I get it. We want to respect those boundaries that we've had our lives and individual sovereignty over choice and privacy. And we want things in many cases to just be as they may have once been, where perhaps our parents are our parents. We don't play a fiduciary parenting role to them. And yet it's so often an area of uncertainty that almost always leads to contention to not have clarity about finances. Deciding early if children are going to help with funding of care or not, and if that's equally spread or not. and a variety of other related topics is really, really helpful. Some years ago, I learned of a website that's no longer up and running, but that website supported families and caregiving, and the most frequently downloaded tool at the time, the most frequently visited page, was a bill splitter that simply allowed multiple interested parties to divvy up and take care of the different costs of care. This can be tricky and sticky, and family mediators and social workers, attorneys, friends, and open dialogue can go a long way. The last bullet here is titled Government and Public Resources. It is a full-time job for someone to navigate all the ins and outs of government and community programs and services. As you look at qualification, eligibility, waiting periods, income thresholds, tax credits, add backs, spend downs, takeouts, forms and paperwork, processing time, advocates, hotlines, all those things, along with the delays and the mistakes and the rejections, the waiting lists, it's enough to drive any clear-thinking human crazy. But there are programs, and they are set up to serve certain populations. And when everything goes through and works, it can really work and help. I'll say this for now. We don't have the capacity in this course to teach the ins and outs, but we do have some experience in this space, and we're building a more in-depth course that addresses these issues. But even then, we recommend that you do your own legwork, while also finding a trusted ally who knows this space so they can help. And they're out there. We're going to talk about that help in our next section, but in the meantime, don't miss this. We've assembled a very simple but helpful, we believe, one-page resource on public assistance, which you can find in the workbook and use to do some exploration. We call it the Caregiver Financial Aid Guide. Check it out.